So the purpose of today's demonstration is to show a quick dermaplaning procedure. Of course, this can be specialized to you and to your patient. But for today, we have taken this patient and cleansed her face with the Facial Wash Oily Problem, which is a gentle lactic acid cleanser. And then we followed up with the smoothing toner. This is a nice, again, gentle, lactic acid toner that doesn't completely strip the lipids from the skin. It still maintains the skin's hydration versus other procedures. Sometimes acetone or alcohol are used, and so again, that is entirely up to the individual clinician. As you can see here on my tray, I have a display of 3 different types of surgical blades that can be used during this procedure. This one here utilizes a handle, and then the blade itself is opened up, snapped into this device, and then just the blade is removed and then disposed of, and the handle is used repeatedly. Here we've got 2 different examples of disposable blades, which I find to be much more convenient. They come individually wrapped. You do your procedure. Some of them come with a plastic covering, and then you put the whole piece into the sharps container, which is, I find, to be a lot easier and a lot less difficult, especially when removing that blade, again, reducing that chance of cutting yourself. Here we have the blue blade, which is a 10 blade that has a more rounded edge versus the green blade, this is the 14 blade that has a more rounded edge versus the 10 blade here that, as you can see, has a more pointy edge to it. This is a great tool to use, this rounded blade, when you're first learning this procedure, because you don't have to worry so much about this edge rubbing up against other parts of the face and potentially nicking, versus this where you always have to be conscious of that sharp point. However, this is my tool of preference, a more pointy edged blade that is a 10 blade. We are approaching the patient. Again, you can do this several different ways. You want to maintain contact. You don't want to just jump on them with a blade in your hand. You also want to make sure that the patient is aware if they need to cough or sneeze or say something to you, that they give you a little warning ahead of time, because if you've got a sharp blade on their face, then that again could increase the risk of causing some type of a cut, which of course we don't want to do. So I have my own pattern for starting this procedure. Other people may have their way of doing it, as well as finding your comfort level as far as the way you hold the blade in your hand. You want to pull the skin taut, kind of like how we do with microdermabrasion, then place the blade on the skin. And you want to go at about a 45-degree angle. We obviously don't want to go like this, because our intention is not to do a surgical procedure, and we don't want the blade to be completely flat, because then it's not going to achieve the goal that we're looking for removing stratum corneum and vellus hair. So here, I'm just going to gently, with just enough pressure, you can see here that she's having nice removal of stratum corneum. It's also nice to have a cotton square nearby so that you can take that debris and wipe it right on that cotton square. Now, different sides and parts of the face require different technique. So here, you want to come along the side of the face. You can see that I'm changing the position of the blade in my hand, but again, maintaining just enough pressure to remove that outer layer of skin as well as vellus hair. Then another tricky part on the face is the jawline. And rather than try and drag that blade along the jaw, it makes it much nicer for you and for the patient to just pull that skin up. And again, finding a comfortable position depending on the direction of hair growth, and then doing that scraping motion again. One of the benefits of this little sharp area here is that you can use this curved edge as its own little mini blade. So when you're getting around the corners of the mouth, this is very useful in just getting right in there, in that corner area there, without having to use the whole blade. So different techniques for different parts of the face are going to really make this a successful treatment. You may also, at the end of the treatment, incorporate specific PCA Skin Serums according to the wants and needs of the patient. So for example, we could complete this treatment. You want to make sure to put a cap on if it comes with the blade. Take any of our serums, in this case Hydrating Serum is a great option because people tend to be very dry. We could apply this onto the skin, or you can even incorporate a gentle blended peel. Sensi Peel is a great option, but of course we have other professional treatments that you can also implement into a dermaplaning procedure. And then you have provided your patient with hair removal, exfoliation, and then putting nutritive peels and topicals back into the skin for a very nice, complete treatment.